How to catch up with rising healthcare expense with the Regence BlueCross BlueShield of Utah HSA Health Plan. Copays, premiums, prescriptions. Healthcare costs keep rising, and you may be wondering how to keep up. When you visit the doctor, the pharmacy, or the ER, you nearly always have to foot a portion of the bill. To reduce these out-of-pocket medical expenses, consider signing up for a health savings account, or HSA. Let's watch how HSAs work. Meet Steve. Steve signed up for an HSA-based health plan during his company's benefits enrollment process. It had lower premiums than his previous health plan. To keep life simple, Steve asked his employer to put the money saved on his insurance premiums back into his HSA each time he received a paycheck. The automatic deduction from his paycheck meant that Steve didn't need to remember to contribute funds to his account. Soon after Steve signed up for his HSA, he received a debit card in the mail, making his HSA funds accessible with a swipe. Steve was pleased that he would save time on record keeping, since he easily could check his balance and manage his account online. But the real excitement and savings came when Steve used his HSA at the doctor's office for the first time. Before he opened his HSA, Steve, whose tax rate is 20%, would have paid $200 in taxes on his $1,000 paycheck, making his take-home pay $800. If Steve had had to pay $500 for a doctor's visit, he would have left the doctor's office with $300 remaining in his pocket. But after he opened his HSA, Steve's pocket stayed a bit fuller after visits to the doctor. Through regular paycheck deductions into his HSA, Steve quickly accumulated $500 while reducing his income taxes from $200 to $100. And at the next doctor's visit, when the doctor told Steve, $500 please, Steve handed her his HSA debit card. This time, when he left the doctor's office, he had used up his HSA balance, but his pocket held $400 rather than the $300 it had held after his last visit. Magic? No. That's just an HSA at work. When you use your HSA card to pay for medical expenses, you save on taxes. Just as importantly, putting aside money in your HSA helps you be prepared when a medical expense does come up. Your HSA balance is there for you day or night, year after year as a safety net against the future. More information about how you can participate in this program will be made available to you during your employer's annual employee benefits enrollment process. Don't let the rising cost of healthcare stress you out. Get the HSA Advantage from Regence BlueCross BlueShield of Utah and Health Equity.